Ladies and gentlemen, the show is about to begin.
New program, good luck.
Very good morning to all. Welcome once again to this Medical Corner, a space where you and I meet every week to discuss medical issues together. I am Nadia Espino Bernal, and today we'll be talking about one of the most fascinating topics in all of medicine. I'm referring to the issue of allergies. So if you want to know what an allergy is, what the symptoms are, how we treat it and the best, how we prevent it, then stay, because we've already started today. Let's start by defining what an allergy is. Well, an allergy is nothing more than an exaggerated response of our immune system to an allergen or a substance that normally does not cause symptoms in the rest of the population. So that you understand me, I am going to give you an example. Suppose we are going to put 100 patients inside a room where there is a lot of dust. Probably 99 of those 100 patients will not develop any symptoms. But there will be one who will probably start with an itchy nose, with itchy eyes, or with a lot of sneezing. Or you will start to have rhinorrhea, which is like water from the nose. And this is precisely because this patient is sensitized to the allergen that is dust. Then we can say that the allergy is not going to be more than a failure of our immune system in the face of different stimuli found in the environment that surrounds us. And what would be the mechanism by which an allergic disease will appear? Well, it has two fundamental stages. In the first moment, what is going to happen is an awareness process. That is, you come with a certain genetic load that means that you are a patient who can develop an allergic disease and you are exposed to a certain allergen, which we will see. What is going to happen is that within your body some cells called B lymphocytes are going to start producing antibodies. They are going to start producing antibodies when they should not be doing so. But your body, your immune system, has interpreted that allergen as a substance that can endanger your body and is attacking it. Therefore, he is going to defend himself. And how are you going to do it? Through the creation of these antibodies that will be called IgG. That IgG will go directly to join with some cells that are called morbits and others that we know as basophils. This IgG is simply going to stay there attached to those cells. And there the awareness process ended. This is what happens the first time we are exposed to this allergen. What is going to happen next? Well, if you are exposed to the same allergen again, then what is going to happen is that your body is already prepared to be able to face that new and supposed aggression. So that IgG that was attached as if it were a little key to a trunk that was attached to the mast cells and basophil cells, what it is going to do is, well, open. She is going to open the cell, she is going to granulate the mast cells, and she is going to granulate also the basophil cells, and all this content that was inside, all this amount of inflammatory mediators will begin to be released into your blood circulation. It is these substances such as histamine that are responsible for producing the clinical manifestations, whether it is the presence of nasal itching, itching in the nose, itching in the eyes, which would be allergic conjunctivitis. There are people who can even get hives on their face, skin, which would be hives. That is, manifestations can appear in different systems. So this is the mechanism that would happen in the second stage, when you were already sensitized, and when now what would happen with this new exposure is the development of symptoms due to the release of all the substances that were inside the mast cells and basophils. Are we born allergic or do we develop the disease? Watch a little of both. In reality, we are born atopic, that is, with a genetic predisposition for us to develop an allergic disease of any type. How does this work? Well, if both parents are allergic, the probability that the child will be allergic would be 70%. If one of the parents is allergic, then the probability decreases to 40 to 50%, and without either parent, he is an allergic patient, since the probability that this baby will develop an allergy in the future when exposed to different allergens drops to 5 or 10%. So well, that is why we say in medicine that allergy is actually the result of a process of atopy, the result of an interaction between hereditary mechanisms, that is, the genetic load with which your information says that you are going to be an allergic patient, and the patient's exposure to the different allergens, that is, the exposure to the environment, is a combination of both processes. You are probably wondering what allergens are capable of causing an allergic reaction. We are going to divide allergens into three fundamental families. In this way we have inhalant allergens, that is, those that we are going to obtain from inhalation, or it is also called pneumoallergens. We have those that we acquire through contact, and we have those that we acquire through inoculation or ingestion. These are according to the entry point of that allergen into our body. These are the 3 families of allergens that we are going to have.
Excellent.
We start with the aeroallergens, which are the first, those by inhalation. Well, here they would be especially dust, which we already know is very common because dust is everywhere. There would be mites that are also closely related to dust. There are 2 fundamentally that the dermatologist should know about, sterone and farine. They will be found especially in places where there is dust and also on mattresses, specifically on that edge of the mattress. Why there? Because when our skin peels off to regenerate, to renew itself, all these scales that we do not see will directly accumulate in these areas, and they, to survive, are dependent on these scales, on the hair, on the nails. That's why they're going to find themselves especially there. Furthermore, as indoor allergens, we can also consider cockroaches, hair, and, very importantly, domestic animals. I already know that they are little people, or rather little creatures that fill our home with a lot of love and a lot of joy. However, it has been proven that both dogs and cats are highly allergenic, with the male cat being the one with the highest allergenic power.
What I missed, it can't be.
There must be some error, but I'm already looking.
Because both their saliva and their feces, their urine and even their hair, will contain proteins that will behave like true allergens and with a high potency to develop your clinical manifestations. Regarding cats, I have something very important to tell you. Sometimes patients come and tell me no, I have already given the cat to my grandmother, but nevertheless I still have clinical manifestations. Well, of course, what happens is that up to 3 months after you remove the domestic animals, specifically the cat, from your homes, the hair, the allergens are going to remain in the environment. They are going to remain in the sofa, in all the things and in all the places that had contact with these animals. What other allergen could we find inside our homes? Well, mainly mushrooms. There are 2 that I want to tell you about. Aspergillus, which is capable of producing aspergillosis in your respiratory system. And then there is penicillium. They are the 2 most common species of fungi that we can find inside your home. Abroad we will mainly have Cladosporium and Alternaria alternata. They are going to be fungi that are going to be found especially on farms, rural environments, and especially in the summer months and at high temperatures.
And now, let's learn about second families of allergens.
We call the second family of allergens contractants. They affect more than 10% of the population and especially women. Let me tell you that they have great power as generators of occupational diseases. And it is that when the skin of women who work in the health sector, for example, is in contact with allergens such as the latex that comes with gloves, both immediate reactions can appear within a few minutes of having contact, as well as delayed reactions, that is, even days later. Contact with the skin of these agents can cause the appearance of a local reaction on the skin, which we will call soap. It is a lesion that will be elevated, will have irregular edges and will have, as we call it, erythema. In other words, it is like a perilesional redness around the lesion and it will be very itchy. Yes. Clinical manifestations occur days after contact with latex or any other allergen that is contact type before. So we are going to call it contact dermatitis or contact eczema, as it is also known, and it is a type 4 hypersensitivity reaction.
And now let's learn about the third family of allergens.
In group 3 we would then have the allergens, which would be due to inoculation or ingestion, which in this case would basically be foods, and within them the most allergenic foods would be eggs, milk, fish, fruits, nuts, especially all the peanuts. Almonds are generally the foods that will induce clinical manifestations such as allergic rhinitis, urticaria, or can even produce anaphylactic shock, which would be, let's say, the most serious expression of an acute allergic process. There is also the case of anisakis, which is a parasite that infects certain sea fish and reaches the body. Once you prepare the fish and eat it, then what other element or what other allergen can cause an allergic reaction? Well, definitely the medications, and among them the penicillins. Among them would also be quinolones, which is where ciprofloxacin, levofloxacin, is found. There would also be analgesics, ibuprofen, analgesics and anti-inflammatories. There would be ibuprofen, diclofenac, and speaking in terms of inoculation, it would be above all the Hymenoptera venom. The Hymenoptera is a family to which bees and wasps belong, and we already know that in their stinger they have a substance that has a high, but very high, allergenic power and is responsible for many acute hives in the patients we see every day. In inoculation consultations we also have some medications, especially anesthetics, but for this there are some tests that must be done. If we already know that you have a history of allergies or a history of atopy, tests are done, which are intradermal reactions, to check if you are the one before giving you that anesthetic or before giving you that antibiotic or another medication. If you are sensitized to that type and if this test was positive, then what we should do is avoid contact, which in the end is the most effective treatment for any allergic patient.
And that's all for today. If you want to get more information about symptoms, preventive measurements and treatment, come and join us to watch the next program. See you soon!